I am Dr. Suman Singhal, Director Cardiac Imaging and Head of Dept of Radiology, Mahajan Imaging, Fortis Hospital, Jaipur. We have almost 8,000 patients coming to us every month with around 1100 to 1200 CTs a month, which include all type of CT scans, including angiographies, non-contrast, all the volume rendered images, the temporal bone. So all kind of cases we do it here. Revolution Maxima is very helpful to us, which was installed last year because it does very fast scanning. It does neuroscan within 2 seconds, chest scan within 3 seconds, chest and abdomen within 5 seconds, and a whole body trauma scan within 10 seconds. So just a breath hold away, we get the whole scan with this CT scan. It is very helpful because since we are doing so many patients, so it helps us to improve our workflow. We are able to give better image quality and better scans within a short period of time to the patients. Revolution Maxima is actually a boon for CT coronary imaging because it does the post-processing itself by Cardiac Express within few seconds. It does by the artificial intelligence. We get the auto labeling of all the coronary arteries, and we can further even do the plaque imaging. Plaque imaging, as you all know, is the thing in coronary imaging nowadays, by which we can diagnose the plaques which are vulnerable based on the CT attenuation values. We can actually do the color coding and we can see which is a plaque which is fatty plaque or which is a plaque which is a fibrofatty plaque. We in fact can get this summary table of plaque IDs which can give even the plaque volumes and how much percentage of different plaque component is there within that plaque. With the SS freeze, that is a snapshot freeze, and the IBR, we can in fact get very good resolution with the CT coronary imaging here, and all the step artifacts, they just vanish. Pediatric cardiology is one of the leading departments in Fortis Jaipur and all over Rajasthan. As we all know, for pediatric department we need the low dose CT, and GE with its Acer V software is able to reduce the radiation dose, in fact up to 80%. This 6-month-old child of congenital heart disease had come to us for assessment of pulmonary arteries. It was a patient of pulmonary atresia. The pediatric cardiologist could not see the RPA at all in his echo. So the patient came to us for assessment of pulmonary arteries, which we did with this cardiac scan. This beautiful volume rendered images. This is a case of truncus arteriosus, and as you can see it here, we can see very small this vessel coming out from the ascending aorta, which is supplying the right lung. There is right pulmonary artery is otherwise atretic totally. This is a left pulmonary artery arising from the main pulmonary artery. So we could make these softwares, this color coded images, the volume rendered images, and the surgeon was very happy. In fact, this baby was operated later and they could join this pulmonary artery to the main pulmonary artery and as a treatment procedure for this hemitruncus arteriosus case. So pediatric cardiac with the volume helical shuttle which we have with GE is in fact very good. Earlier, whenever we used to do the lung CTs, anytime the pulmonologist or the surgeons used to ask us about the lung volumes, the radiologists, we used to feel very helpless because we could not calculate the lung volumes at all. But with this thoracic VCAR, it is just a click away. So we can get these lung volume rendered images of the whole lungs, and with this data set table, we can get the lung volumes. In our daily practice of doing the CAT scans, we have to repeat the scout images so many times earlier because of the improper positioning or the mispositioning of the patients. So with this GE's AI-based detector for auto positioning and auto centering, the life has become very smooth because the machine itself detects the center of the patient and positions the patient itself. So we had kind of no touch technique to the patient. We have to just put the image and see which scan is to be done, and the patient itself is positioned by the machine at the proper center of the patient. So it is very helpful. In fact, in patients, in-house patients, this technique is very helpful of auto centering and auto positioning. We are able to reduce the radiation dose as well as it improves the clinical outcome in our daily practice.